thanks for joining us here tonight. We have Taylor and myself. I'm Jessie, the PA here. Taylor's the nurse, and we are going to be presenting on Sculptra. So first of all, we wanted just to say cheers to, we're sort of post-pandemic, and we're in our 8th annual customer appreciation right now. So we have these beautiful Tiffany mimosas, so we thought we would just take a little toast, and hopefully you have one at home. Cheers. Fresh mint in there. So a big thank you to all of our existing and new clients that have not only supported us over the past 8 years, but really this past year. I mean, seeing us through the pandemic, and I feel like we're on the other side. We're mask free, which is phenomenal to see everybody's smiling faces. Endorphins are being released again, definitely. So, but anyways, so welcome to our event here tonight, and we're gonna start with a video about Sculptra, and just a little bit for those of you who are new, may not know us. We really are here to be your skincare experts, not only from just topical treatments. We have estheticians that are gonna help you, boost your skincare regimen. And then Taylor and I are really gonna be your experts on all the cosmetic injectables. So tonight's focus is gonna be on Sculptra aesthetic. It's a little different than kind of the typical hyaluronic acid filler that people are familiar with. So we'll talk about all of those details. And then we'll get started on a brief intro video here. If you can't see that, that is also going to be posted on our event page.
And then the next video that we have just kind of shows a little before and after photos of some patients that have received a series of Sculptra.
This one goes upside down for some reason. Here we go. hopefully you learned a little bit of something just from that. So I think we'll be taking questions as we go along here too, but one of the main things that really sets Sculptra apart from, you know, some of the hyaluronic acid fillers is it is a semi-permanent filler. So it's called a biostimulatory filler, and what that means is that it's stimulating your own body's natural collagen. So that's very unique to that product. And anytime we're stimulating collagen, that means that the results are not gonna be instant. So they do take several months to progress. And when you think about what Sculptra is doing is when we really can globally revolumize. So my specialty is kind of full facial rejuvenation. So rather than somebody coming in and maybe just filling a particular area, maybe just the lips or filling a line or lifting a cheek, Sculptra is really able to address kind of that full facial rejuvenation and really think of it as volume restoration and really replenishing collagen from a very deep level. I don't know if you saw that picture on there, but it kind of shows these little collagen strands as we age, and as we'll all kind of start to do this and kind of say my skin's getting thinner and it's kind of drapey. What's happening is those collagen fibers in there are weakening over time, and I think of them as just kind of being a little bit weak. When we put that Sculptra in there over time, it just really tightens those collagen strands back up, and thereby just kind of making the skin a little tighter. It actually thickens the dermal layer. People will start to notice that their skin just looks smoother, more radiant, and we'll have Angie here, you know, kind of give her testimonial to her experience with that. So, but I thought you could talk a little bit about like what the hyaluronic acid fillers are, because most people are familiar with lip plumping and that type of a thing.
Yeah, so hyaluronic acid dermal fillers, of course, serve a purpose. They're powerful tools. However, they do add immediate results as opposed to Sculptra, which again, like Jesse said, it's a very gradual onset of result. So fillers can be used, you know, particularly in places of concern. So whether that be lifting your cheeks, softening some smile lines, or plumping up your lips. Fillers will last, you know, anywhere from 6 to 9 months upwards to, you know, past or beyond a year. Sculptra, again, is going to give you, oh, I'm not visibly seeing, you know, the outward aging changes. I'm treating within from a, you know, deeper level to prevent, essentially, and slow down that aging process. You know, ultimately, a healthy complexion goes along with having a healthy supply of collagen. So by replacing that, I will maintain my youthful complexion and prevent, you know, or slow down that aging process, which is the ultimate goal. Compared to in Jesse's, you know, case, doing a more...
I'm more in the rejuvenation phase.
Yeah.
I'm in the advanced aging phase actually, but just kind of to touch back on what you said, you know, with that prejuvenation, that's really been a huge paradigm shift in this industry. So I've been doing this now for about 18 years, and never have I seen, you know, so many younger, you know, men and women coming in and really doing treatments on a preventative basis. And I mean, when I think about it, this is aesthetic medicine. This still is, you know, a field or specialty of medicine. And when we think of anything, you know, in life in terms of our health and wellness, don't we want to be preventative? We want to prevent things before they happen. So this really makes perfect sense. I mean, you know, we encourage, obviously at a much younger age, you're not going to be doing as many things, but, you know, starting from, you know, use of your sunscreen and being careful in the sun so that you're preventing some of that sun damage. I mean, and if you're doing a little bit of Sculptra now, I'm like, I mean, even starting Botox at a young age, I mean, you're never gonna get those deep lines, and that's awesome, because if you start when you're 50 or 60, and you come in and they're already deeply etched, you know, into the skin, yes, these treatments are still great tools, and they work, but we just still have a little bit more work to do, you know, rather than starting younger and just building on and doing a few of those treatments, you know, over time.
Yeah.
So, so you know, when we talk about, you know, who is a candidate for Sculptra, I mean, realistically, I mean, like it said, you know, we start losing our collagen in our 20s. Doesn't mean you have to come in and start doing Sculptra when you're 20, but probably in your 30s, 30 and up. For myself, I'm gonna be 50 this year, so I've done 4 vials of Sculptra, and then, you know, I'm gonna try to keep up on, you know, doing about 1 to 2 vials a year, because we we are still continuing to lose volume. So even though we know Sculptra can last 2.5+ years, that's just when the clinical study stopped. So it doesn't mean the collagen stops at 25 months. We firmly believe that things go further than that. It's just that that's what we have to say, from a clinical standpoint. So, but we should use that little, we have a fun little tool. It's a collagen loss scale. So we can actually plug in somebody's age, and then we can determine roughly how much collagen you've lost. And then based on your age, that will determine how many vials of Sculptra. So we do something called decade dosing. So for somebody who's 40, we say for full collagen replenishment, we want to use about 4 vials. So for my typical, patient or clientele, we're using about 4 to 6 vials to see that full volume restoration.
So for example, if we just plug in 35, that just goes to show at 35 years old, a person has already lost 15% of collagen, which again will only continue to decrease by 1% as the person ages.
It just only goes downhill from there. So let's plug in, 50, how much volume,
So 30%.
So, 30%, and that's really globally, throughout your body. So we're losing collagen, and if you notice, even just in your arms and in your skin, right? Our collagen it's thinning everywhere. So does anybody else want to plug in an age, and we can tell you how much collagen you've lost?
38. Let's see. So you have lost 18% collagen already.
Time to get a Sculptra treatment.
Time to get a Sculptra treatment. So that's kind of a fun little tool. We don't necessarily determine people's specific collagen loss when they come in, but it is, the scale is based on clinical studies and things like that too. So like I said, age is really what determines, how many vials and how much volume we want to replace. The other factors that play into that are, whether somebody's had a significant amount of weight loss. So, sometimes we'll have people come in and they've lost a bunch of weight, which is always phenomenal. It's great, from your health and wellness standpoint. But unfortunately for some people, they'll lose that weight in their face. And, their skin will get pretty loose and they want to know what they can do. So weight loss, whether somebody's, had a recent illness, things like that, or they just have maybe facial features they have a long, thin face. Those are people that really make perfect candidates for the rejuvenation purposes of it. So you kind of touched on already about that comparison to hyaluronic acid. So I think we're going to introduce Angie. Angela is graciously decided to come in and give her testimonial on having a Sculptra treatment, and then she also did a series of BBL treatments. So the same BBL, which is broadband light, it's our Forever Young treatment, is really the icing on the cake because they are both collagen stimulating treatments, but the BBL addresses more of the sun damage, and so she's just had a phenomenal result, and is going to share some info on that.
You can come on over. I'll swap spots with you. You can take a seat next to Jessica.
And I'm going to are you okay if I bring your photos up?
Yeah, no.
On the screen, because you have some amazing, beautiful before and after photos. All right. So this is Angie, and we started doing her Sculptra treatments back in December. And we just recently finished your last Sculptra treatment and your BBL, and I thought you could just kind of share with people just kind of that journey, because I think the big thing everybody wants when they come in is they hear, oh, Sculptra takes time. I want instant gratification, right? This is kind of the world we live in.
Yeah.
So there is that expectation, so it'd just kind of be nice to hear kind of how that went for you.
Thanks, Jesse. My name is Angie, and I did come in the beginning in December of this year. I'm 51 years old, and I am a product of being a teenager in the 80s. So it was all about being a tan and shoulder pads, right? You didn't have the proper stuff to go out in the sun with. You found what you could to lay out and keep tanning and get darker, darker, darker. So with that, going into my older me, I continued on staying dark. My theory was that gave me a glow that I was missing as I grew older. So the 80s kind of stuck with me into, as I aged. When I met Jessie for the first time, she opened my eyes to all sorts of different things that would be, that I would be a candidate for. And then where do you go? What do you choose? What is the next steps? And that's what's great about Jessie and Renew You is that you're able to get in and really, gear a plan that works for you and that works for your face, works for your structure and the amount. It's not even just your age, but it is, I guess I'm gonna self-profess that I think I had the most sun damage there was, that somebody can do to their skin. So coming in to Renew You Medical Spa and meeting Jessie, I really had serious sun damage. And it was almost irreparable damage that I felt. So at that point, I remember crying with Jessie and saying, I'm in the grocery store and I feel like I'm trapped in a body with this youthful me. And I was afraid or very timid to make eye contact with people because I knew that I didn't look like me. And I didn't look, my age was well beyond what I felt inside. So I remember just walking through grocery stores, Target, you name it, and I would pull back and I would not make eye contact. And that was a huge, it affected my confidence. It affected how I would speak. It affected every aspect of my life. And so going into being 51 this year, I just feel very, very excited that with my skin now going through Sculptra, I think the first thing I ever asked Jessie was about Botox. And it's what can we do to maybe freeze everything? Or what can we do? And she really educated me on Botox and the benefits of those and benefits of other type of fillers. But what worked best for me was really working at the skin floor and working at within my facial structure and everything, all the components that go into giving me the volume. And I received the volume that I have now that I'm very, very proud of. I walk with the way that I feel inside. And so it represents who I am, my face does now. So with Sculptra was the patience, definitely need patience, but the results are astounding. I cannot say enough of good things about Sculptra in the fact of where my skin was even 6 months ago to where my skin is now. And to how I feel when I approach somebody or ask somebody a question. The timid me is gone, and it's that stepping stone with the gradual lift of Sculptra has happened to my demeanor, has happened to my confidence level, has also shifted. So it's this gradual road and progression that I cannot speak enough of, that it is a beneficial thing to do. I'm excited to kind of look into 52 and 53. And I'm not gonna sit back on the sidelines anymore. And with Botox, I love the effects of Botox, we all do. But it is that steadfast, kind of that steady, and again, with coaching from Jessie too, it's like, just be patient, be patient and all that will kind of come full circle. And so now coming from, December to now, I can feel my skin is acting more youthful. But there's an energy there. There's an energy lying underneath my skin that feels that I've got not even a bounce, but it's a vitality that my skin has absolutely, it's a sponge. It's soaked up everything that collagen has given for me and literally bridged the gaps between the pieces that have separated that age robs you of, right? So it's given me definitely a brighter outlook. I'm a little more sassy. And I like that. I do have more energy. I do have one, I was just a couple of days ago, I went to see my hairdresser and she just said, you look amazing. She could not stop. She goes, I cannot believe, you know, I can tell you what, I didn't move to a mountain and change my sleep routine. I didn't get any more rest than normal. I'm the same old person, but she says, your skin is vibrant. She could tell in the way I carried myself and the way I spoke. And then she also could see it visually on my skin. And coming back from, again, this amount of sun damage I had to now, and being at the age 51, it was, it's amazing.
Yeah.
So,
Well,
thank you.
Yes, you're so welcome. I just love that. I mean, that's why I get so much joy out of what I do, because it's so fun to be able to transform. And I think the most important thing is to really notice is how natural this looks. There's a lot of negative connotations, you know, out there, you know, in the world right now about fillers and Botox and things like that, and people are over Botoxed and overfilled. You know, we're all about getting people back their own natural beauty. You know, we want to restore what you used to have, and we're not creating features perhaps maybe that you've really never had. So I think that, you know, your before and after photo is just, I mean, it speaks volumes. I mean, you know, you can just see it globally, your face looks fuller. The sun damage has been, you know, reversed essentially. Obviously, she's been on a very good skincare regimen at the same time, but I mean, just phenomenal results all the way around.
Yeah.
So
Yep.
yeah,
It's definitely, and again, Botox or other fillers, and it's just, again, you address the issues of really filling the face out before you try to freeze things and stretch things. Let's get to a better you, and it is me. It's still me, and I definitely have. I'm a very expression-oriented person, and I definitely have all of that. And the before and afters are just amazing. So.
and it boosts your confidence. I mean, that's the best part, right? You're giving people back, you know, self-confidence, self-esteem, and you know, I think that's very therapeutic, and you know, your testimony says it all. So yeah, it's fun. I cry with patients all the time because they're just so ecstatic, and it just makes me feel so good that I'm
More
making
than
a
once have
difference.
I shed a tear in your office, but it was out of happiness, really, true, like shock. It was like, that's what I looked like when I was 30. You know, I feel that volume that I didn't have for such a long time, and it brings you to tears.
Yeah.
So Sculptra is amazing, and I would have never known. I would have glanced over it, gone right to Botox or something else, and it's well within its own rights to be talked about, and it's a viable, definite option.
Well, thank you for sharing. That's awesome. Very
You
nice.
bet.
Yeah. Well, do we have any questions that are popping up on the video at all? Okay, is it on? Hopefully it's on. This is our first event post-pandemic. We're trying the whole Facebook Live thing, so hopefully it's all on there. Well, feel free, the video is gonna be posted on our Facebook page. The video that we shared earlier will also be posted. Feel free to pop any questions in there, and we can certainly answer those throughout the evening here as well. So that is gonna conclude the event for this evening, if there aren't any questions. Thanks for joining us, and then tomorrow night, we also have our estheticians that are gonna be presenting on Skin Pen PRP and the VI peel. All right, have a great night.